Up too, for
We're good? All right. Bring the meeting back to order.
Okay, good evening, everybody. Welcome to the Queen Anne's County Commissioners Meeting. This is a public meeting that is being aired live on our local cable television station, QATV 7. These media broadcasts provide county citizens an opportunity to watch and review our scheduled public meetings. In addition to our live audience this evening, we are providing remote options for citizens to watch and participate in county commissioner meetings. Citizens may watch our meeting live on our website at qac.org/live or on our public access governmental television channel provided by BreezeLine Cable Services. Citizens can also participate by joining the live Zoom meeting by going to qac.org/public comment, and citizens may also email comments to publiccomment@qac.org. All comments received will be summarized during the press and public comment period on tonight's agenda. We acknowledge everyone's participation, and by attending, you acknowledge that this session is both recorded and aired. Press and public comment will be taken and is limited to 3 minutes per person. If you do care to speak, please sign up in the information table in the lobby. Any comments longer than 3 minutes can be submitted in writing for the Commissioner's review. We will now stand and be led in the Pledge of Allegiance by Commission Vice President Jack Wilson.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, Commissioners, that brings us to the approval of our agenda. So our agenda for tonight's meeting, March the 10th, along with the regular session minutes, the closed session minutes, the sanitary district minutes, and the roads board minutes from the February 24th meeting have been circulated for review. Do I have any additions or corrections?
I make a motion to accept the minutes and the agenda as proposed.
Have a motion to get a second? Have a motion and a second. Any discussion? Seeing none, all in favor?
Aye.
Opposed? And one absent.
All right, thank you, Commissioners. All right, so we just held a closed session under the General Provisions Article, Section 3305B1 for boards and commissions, and Section 3305B7 to consult with counsel. And I do believe we have some board appointments to make.
We do. I move to reappoint, this is the Broadband Advisory Council. I move to reappoint Mr. James Benson, Mr. Ed Cummins, Allison Davis, and Jared Rickard. These terms will expire on March 31st of 2029.
Second.
Get a motion and a second. Any discussion? Seeing none, all in favor?
Aye.
Opposed? And 4 and 1 absent.
Are you going to say one absent all night long?
I am.
You can just assume.
Oh, by the
that-
way, actually, let me put that out there. So Commissioner Moran is on assignment tonight, so I'm filling in his spot. So
He's on Zoom.
I didn't feel worthy to sit in the big
he was just
chair,
here
so I'm going to stay over here on my side tonight. All right, go ahead.
All right, thank you, Commissioners. That brings us to press and public comment. Do we have anybody for press and public comment this evening?
We do.
Okay. So we appreciate all citizens for taking time to express views to the county commissioners. Comments are limited to 3 minutes per person. Comments longer than 3 minutes can be submitted in writing for the commissioner's review. This commission respects your desire and right to convey your message freely. When you come forward, please speak clearly at the standing microphone, state your name, your address, and your topic of interest. And in keeping with the dignity of our office, we ask that all views be expressed in a respectful and civil manner.
We have Mr. Jay Falstead.
Good evening, Commissioners. Jay Falstead, Queen Anne's Conservation Association. Back in 2022, when the state released its first environmental assessment on the Bay Bridge, QACA read through it. We hired a couple of consultants, hired a law firm to evaluate the state's work, and we're very concerned at the time that the state's environmental assessment at the time was deficient in a number of different areas. We submitted comments during the Tier 1 review, and we were told that the deficiencies that we identified would be addressed in Tier 2. This past January, those comments, or the new DEIS was released, and we read through it again, and we're shocked that a lot of the things that the state said they were going to address in Tier 2 were still deficient, only this time they were worse. And so I bring this to your attention because there are some real substantial impacts to Queen Anne's County. This will all be on the QACA website tomorrow. But we went on ahead and submitted our comments. It's a total of about 20 pages worth of comments. We evaluated all of the state's work using their numbers. The document that the state has put out is in conflict with itself. And the conflicts are so substantial that Queen Anne's County is going to bear the brunt of the state's mistakes. And so what I want to do is point to page 9, and for the commissioners and for anybody watching on TV, as I say, this will be on our website, I urge you to read the second paragraph, and if you don't mind, I'd just like to read it, because this is sort of the shocking part. The induced demand that will result from the Bay Bridge will return to current congestion levels in a shorter time than even the construction period. It'll relieve congestion for only 3 to 5 years before it returns back to current levels. So imagine that for a second. We're about to spend billions of dollars on a Bay Bridge, a construction period that's going to last for 10 to 15 years, a huge amount of disruption on Kent Island. Kent Island's going to bear the brunt of it, for traffic relief that only is a period of 3 to 5 years. I think we're making a big, big mistake. And so after I send this to you, I hope you'll all read it. I hope our citizens will get more engaged on it. But I think we're stepping into a tar pit that we're not going to be able to get out of. And as I say, Kent Island is going to bear the brunt of it. All those residents along Route 50, all of those businesses, it's our county that's going to bear the brunt of the state's mistakes. And so with that, thank you very much for the time.
Thank you.
Thank you. That's all we had to sign up. Does anybody else want to speak during press and public comment? All right, seeing none, we'll close press and public comment.
All right, thank you, Commissioner. All right, so moving on, we have legislation this evening. We have 2 public hearings. So if you want to turn to tab number 7, Mr. Thompson's coming on up. So the first one is public hearing on County Ordinance 2601. This is a bill entitled An Act Concerning Traffic Control Signal Monitoring Systems, Red Light Cameras in Queen Anne's County. Mr. Thompson? Andrew Moya here from our Sheriff's Department, representing County Sheriff.
Welcome.
This is a public hearing being held on County Ordinance number 2601, a bill entitled An Act Concerning Traffic Control Signal Monitoring Systems, Red Light Cameras in Queen Anne's County, for the purpose of authorizing traffic control signal monitoring systems in Queen Anne's County, providing definition and providing for operation and administration of such systems, providing for trial requirements, civil penalties and defenses and adjudications, providing for the use and confidentiality of recorded images, and generally authorizing and regulating the use of traffic control signal monitoring systems in Queen Anne's County. This hearing being held Tuesday, March 10, 2026, 5:40 p.m. in County Commissioner Meeting Room, Liberty Building, 107 North Liberty Street. Copies of the ordinance have been available at the County Commissioner's office during regular business hours and online at the county website. Speakers will be limited to 3 minutes each. Written testimony of any length can be submitted on or before the hearing date. All hearing sites are accessible to individuals with disabilities. Part of the record of the proceeding will be a certificate of publication indicating that notice of tonight's hearing was published in the Bay Times Record Observer for 2 successive weeks, both being newspapers of general circulation in Queen Anne's County. Are you,
From Sheriff's Office.
okay. We've got one person who signed up. Did you want to say something to the commissioners?
I just had a question real quick.
Sure.
So this doesn't affect lights on state roads, correct? This is just county roads?
It'll be actually state roads. It'll be on Route 8. Both cameras will be
overpass.
placed at Mattapee, where
Right.
we've had some horrific issues over there, and some other issues over at the exit ramp coming off of Route 8, where everybody seems to want to go through a red light signal just to get onto Route 8.
So I guess, so the state relinquish their authority over their lights to us, I mean, I'm good with it, you don't understand, I'm happy about that, but
Well,
I'm surprised.
Again, it'll be planning and working with the state.
Okay, so you're gonna get their approval to do, okay.
It's a law enforcement agency that has primary traffic control with that intersection.
Well,
So-
even though the state police are primary for any state roads, it's in our jurisdiction. I think we'll take
gotcha.
the lead on that and work with the state to put these cameras up there.
Yeah, I remember when these two bills got passed at the state level, I was just curious how they worked out when they authorized that you could do that and ask for that outside of school zones and all that stuff.
Well,
so.
again, we're also gonna be going into, the other legislation being proposed tonight. too.
Right.
So they're gonna run concurrent with each other.
Okay,
And the programs, both of them will be running concurrent with any of the programs that the state is gonna jump into as well.
gotcha. Any other questions?
Obviously, we need their approvals.
Right, I gotcha, okay.
Yeah, I mean, I was gonna say, this sort of applies to both of these. I'm normally against the sort of
Right.
camera citation things.
Yep.
Me too.
Particularly because I've gotten them in DC where it's like $200 where you're speeding through and you get it in the mail like 2 months later and it doesn't do anything.
And they have one every quarter mile.
But I think this is sort of what they're proposing is a little bit different. These are areas where we have
Issues.
people who they're not modifying their behavior to drive safely in areas where we have citizens who are being maimed and killed in accidents in an all too frequent basis. So for the next one, in a school zone, we've already have them on, if you go past a bus, you're gonna get a ticket. If you speed through a school zone when their kids are getting out unloading, you should get a ticket there too. I don't have any sympathy for that. Particularly at the Route 8 overpass, there's a lot of people, even if they don't cause accidents, they're clogging up that intersection, and now we're creating more delays for people in the morning as a result of that. A lot of this could be avoided if people just mind their manners that their parents taught them and wait their turn, but they're not. So this is a way to try to get that flowing in the way that it should happen. And so I think these are different from
Now, will these
some
have
of the ones that
restricted
don't.
hours? Is that the idea behind them, similar to school zone cameras, or are these gonna be 24/7?
Cameras will be in effect, in accordance with the laws for whatever the times are.
Okay.
So,
School one will be hours.
yeah, the school one will.
Yeah, that's, okay, all right. Okay,
Any other questions?
nope, I'm good.
There's one person signed up to speak, Eric Lavaseur.
I have the same questions for both the red light and the speed. Should I wait till the speed's over, or should I?
Yeah, you can wait till, that's what we call next. We'll call the speed camera one next and you can talk to both of them.
All right, it's the same questions I have for both, so should I wait? or-
No, just
Whatever
say
you
it now
wanna do.
and-
All right. My name is Eric Lavasser, resident of Queen Anne's County, reside in the Chester, in the Harborview community, where I'm the community president. I have a couple of questions. We have a couple of concerns regarding the red lights, and I'll speak the same questions regarding the speed cameras. We call them safety cameras. What is the percentage breakdown of the proposed $100 fine? After the administrative costs, where's the remainder of the fine going? If the administrative cost for these cameras increases, will the citizens be on the hook to pay the increased administrative costs for these cameras? How much of the cost to install these cameras will the taxpayer of Queen Anne's County have to pay? The proposed $100 fine seems to be excessive. A lot of students are going to these schools and their parents are telling their kids, you need to be responsible. A lot of these kids don't make enough money to pay a $100 fine as they're going and coming. The first couple of times they're going to be hit and they're going to have to come up, and then they're going to have to turn to their parents to pay that extra cost. What does prevent Queen Anne's County from increasing this fine at a later date? Who will be responsible for calibrating these cameras? Is it going to be the vendor, or is it going to be Queen Anne's County that calibrates to make sure that these cameras are operating properly? We recommend that the funding source goes to the Queen Anne's County Sheriff's Office for community initiatives like speed enforcement and community outreach. We have a lot of people that come in our community because we have 3 churches. We would like for that funds to go to the Sheriff's Office so that they can come in and enforce speed laws and other community initiatives within the Harborview community located on the center of Kent Island. We simply ask that Queen Anne's County manages this program as it is intended. Please do not follow the slippery slope by using this program to offset budgets or pet projects. Make sure that the potential funding source and stream stays where it is intended. Thank you.
Thank you.
The gentleman person signed up. Is there anyone else that has any public comment? County Ordinance 2601.
Do we want the major to weigh in on
Yeah,
those
Major, do you know
questions
the
if you
answers to any of
could?
those questions
Do you have any
off the top of your
answers
head?
to
If
them,
not,
or-
we'll get them
If I
for
can
you.
remember all, but yes, the intention for the program itself is to reduce speed, to mitigate poor driving behaviors, and to get people to actually start paying attention to what they're supposed to be doing. Reducing any injuries or any accidents or fatalities, any school zones. We strategically looked at these areas. These are areas in which we have a lot of students, a lot of kids. We already know that we're already in the bus patrol program. That too is to protect our citizens, our kids, and it's working out relatively well. These are strategically placed, or asking to be strategically placed in locations which would mitigate some of those issues for kids going to school, going across the roadways, people speeding through those areas. As some of you know, living in Graysonville becomes very
Elementary
fast.
school.
Anywhere in front of the middle schools, the high school, and Mattapique, it becomes a speedway. And we just don't want people injured. We want to reduce that. Inherently, by laws of the program and the state of Maryland, those funds that are revenue generated do go back to law enforcement. They go back to the sheriff's office for more programs, more outreach, more education. We intend to utilize a lot of those funds to enhance our existing programs and create new programs that we can educate the community.
So,
For additional enforcement efforts.
so I have a question. One of the questions that was asked was the direction of those funds. So they're not going into the general fund. The fines will be paid to a third-party contractor who pays the sheriff's office?
That's correct.
Okay.
So the vendors operating the cameras, calibrating the cameras, just like they do in Centerville and everywhere else.
That's correct.
And how much,
That's what I was getting ready to get to.
And then one more is the fine amount. Is that set?
The fine amounts on the red light cameras will be set by legislation, which is already set.
I know, it sets it in there now.
Pending
Where
legislation.
did that number come from? I think that's
Comes from
probably
the
the
state.
question, is that?
State regulated. The same thing with speed cameras. Speed camera fines are set by the state. They are passed through legislation, and they were just increased this year.
Now, the speed limit maximum before the ticket is triggered? 12 miles over the posted?
12 miles over the post speed limit.
Okay.
The vendor pays to put them up, right?
Yeah,
And
the
they get
county
what's their
assumes no
percentage?
cost for installation, operations, or anything else like that. Where they get their money is on the backside of all the citations that are issued. They get
What's
a
their
fee off of that.
percentage?
Their percentage is between 35 and 40%,
And then, so you would get the
60%. That's correct.
So you would then ask the county commissioners for less money in your budget?
Potentially.
Hey, he didn't even
Listen,
crack a
let
smile
me
with
tell
that.
you
I'm all right with that,
Or,
Patrick. Don't-
or we can increase our efforts throughout the county. I mean, you know,
He's against law enforcement, you just heard him, he just said it. He's on the mic.
If you get citations, we'll make sure that we do good with your money.
Major, we know that our sheriff's office does an amazing job writing grants and getting monies from Homeland Security and other governmental agencies that write grants for law enforcement in our county. You guys do a great job in getting those grants written and us getting that money.
And I think the hope
So
is
shame on you, Commissioner.
that there wouldn't be, the hope is that there would not be a lot of revenue after a while from
Right.
these.
Well, and again, the whole idea is what? To
Not be
condition
speeding
these
through school
people.
zones because
Well,
people would know to slow down.
And some of the statistical data that has been proven is something, for instance, once the cameras go up, just take general numbers of if 1,000 citations were issued off of one camera in the first month. Inherently, because of changed behaviors, they're gonna go down.
Right.
So say then 450 individuals get tickets the following month or 2 months later, or whatever it may be. You can ensure that that program's actually working. And it is also statistically found that school-related incidents with accidents and everything else have gone down 70% by just having these cameras in school zones. So, it's a win-win for our county, our folks, and our kids.
So, does anybody else want to speak?
We've got the other hearing on the speed
I know,
camera.
I know, but I'm going to go ahead and keep close this one out, but keep the record open for 2 weeks.
Yep.
So,
Yep.
and then let's go ahead and move on to the next hearing for the speed camera.
All right. This is tab 7, item 2, Commissioners, County Ordinance 2602 for speed monitoring systems in Queen Anne's County. Mr. Thompson?
This is a public hearing being held on County Ordinance 2602, bill entitled an act concerning speed monitoring systems in Queen Anne's County, for the purpose of authorizing the use of speed monitoring systems in Queen Anne's County, providing for the locations of such systems, providing procedures for activating such systems, providing for the issuance of warnings for the first 30 days after activation of such systems, providing for hours of operation, providing authorization to acquire and use such systems and to enter into agreements for furnishing such systems, providing for the imposition and payment of civil penalties for citations issued as a result of the use of speed monitoring systems. This hearing is being held Tuesday, March 10th, 2026 at 5:45. County Commissioner Meeting Room, Liberty Building, 107 North Liberty Street, Centerville, Maryland. Copies of the ordinance have been available at the County Commissioner's office and online at the county website. Speakers were limited to 3 minutes each. Written testimony of any length can be submitted before the hearing date to the county commissioners. All hearing sites are accessible to individuals with disabilities. Part of the record of the proceeding will be a certificate of publication indicating the notice of the hearing was published in the Bay Times Record Observer for 2 successive weeks prior to tonight's hearing. Mr. Lavaseur, you had also signed up. Do you have anything else you want to say on this?
Do you want to just give Stephanie your written copy so she can just put that into? Yeah, do that so she can just enter that into the record for both hearings.
Eric, you can email
want me to
us.
read this
You
all
can,
over again?
you can email us the
No, you
question.
can just email
As
it.
long as you give her the written copy, she'll get it into the record because it's
Yep.
going to be the same testimony, so.
Thank you.
Yep, thank you.
Thank you, Eric.
Do we have any questions before we move on from this one, or are we good?
Good.
I got them all out in the last one,
Yep,
too.
me too.
Okay, great.
Got out of my system.
Anybody else want to speak on this hearing? All right, seeing none, we will close the hearing today and keep the record open for 2 weeks. Thank you, Major. Good one.
All right.
Stay safe out there.
Thank you, Major. Thank you, Major. Thank you, Mr. Thompson. All right.
Pat,
All right,
Thank
all
you.
good news tonight. Look at you.
that's right.
I love it.
It's always good news.
Yeah, well,
All right, Commissioners, moving on, we have presentations next. So if you want to flip to tab number 6, tab 6, item 1, pages 1 through 14, we have Mr. Bryce Strang, our County Health Officer, Queen Anne's County, here for his update, and he also has a special guest he'd like to introduce to you this evening. And we have a presentation up on the screen as well.
Good evening, gentlemen.
Bryce?
So today, yes, I brought my relatively new Deputy Health Officer, Dania Benton, and I wanted to introduce her. She's my left-hand lady.
welcome.
Welcome.
Taken on the reins and has done an outstanding job. You started in, what, October? Yep, so she's doing a great job, and she's here to,
She's old hat then, if she's been here since October.
but yeah, doing a great job and helping me out here today. So today I'm going to talk about, or try to demystify a little bit the complexities of the AHEAD model, state and local health improvement plans associated with the AHEAD model, as well as the Rural Health Transformation Program, which we have some promising insight into. So as a reminder, the AHEAD model is achieving healthcare efficiency through accountable design. That is the new CMS waiver that Maryland has signed into effective last year. It'll be implemented this year through 2035, and again, it builds on previous models that Maryland has implemented over the decades to have accountable cost, not blowing costs through the roof, also improving quality of care. The 2 big differences I wanted to bring up with the AHEAD model are, first, are the cost setting. The big change with this model is Medicare will be setting the rates, which does bring up some concerns with if they drop the rates to Medicare rates. It could affect reimbursement overall for everybody. The other good part about it is they recognize that it's a bigger picture problem. It's not just on the hospitals, it's all inclusive of public health, primary care, the hospital system, everybody involved in the whole continuum of care of health in general.
When do we get that? When do you know what reimbursements are?
When do we get the rates?
Yeah.
I do not know that answer. Part of the AHEAD model is it requires a state population health accountability plan, other known as the PHAP. The PHAP is the state's plan. We are required as a local jurisdiction to develop a local accountability plan. But I will talk about the 6 measures that Maryland has chosen in the AHEAD model to tackle. But basically, these targets will help Maryland focus resources towards improving these health measures in population health. Again, we will be creating a local action plan, and the hospitals will also be creating an action plan as well that will be tied into what we're doing. So they're going to have a lot of matching components. So these are the 6 PHAP measures that the state has decided to jump on. These were determined by the state after a thorough review of, what we could currently do and build upon based on what we already have in place and what we think we can make meaningful impact on over the next several years. I could go through each of these. It might take a little while, but basically what we're going to be doing is using different data sources to identify and track changes as time goes on as we implement our action plans. Good news is that a lot of these measures Queen Anne's is excelling in already. We're leading the pack in the state in a lot of these things, but we can only get better, right? So the plans will be addressing those items. Are there any questions on these measures that you would like me to address? You will notice that some of them don't have a change from the 2023 baseline, and the reason why is, as a state, those are getting worse, and they're trying to stabilize it over the next 2 years before trying to improve it. So that's why you'll see that 2 of those measures don't have any change. All right, the local action plan that we are putting together, again, is to have an effect on those 6 measures. The local action plan is a process being led by the local health departments in partnership with other healthcare providers in the counties. We in the Mid-Shore have decided to tackle this as a region, and the reason we did that is because we often have the same different partnerships. We didn't want to have 5 separate conversations talking about the same thing with 5 different counties. So we decided to come together and put a plan together as the Mid-Shore. We also are able to take advantage of a potential additional fund for coming at it as a 5-county group. The more hospitals you had, the more opportunity you had for additional funding. And if at the time when we submitted this, we haven't heard back yet, but we were able to get, I think it was an additional $10,000 because they considered the freestanding ER as a hospital. So that's why we went at it as a region instead of an individual jurisdiction. So again, we're going at it as a region. The 4 main work groups consisting of multiple partners are listed there. The reason these 4 specific work groups were considered are because they tie to the state health improvement plan, which I'll talk about in a minute. Again, access to care, women's health, chronic disease, and behavioral health are the 4 main work groups that are being put in place. I start chronic disease because Dania is actually the head of that chronic disease work group. Your first meeting is very soon, isn't it?
Yes, March 24th.
As a reminder, hospitals are also required under the state agreement to create their PHAP. Again, it's going to be tied closely into what we're doing across the Mid-Shore and in Queen Anne's County. Shore Regional Health, we've already started talking and meeting with President Kozel along with his senior staff to figure out what we're gonna do. So we met approximately, I think, 5 or 6 weeks ago. So we're already making progress on developing a plan. Of course, they've also committed to having their staff attend these work groups as well to put together a comprehensive plan. So SHIP, that is the State Health Improvement Plan, and that was actually put together and made effective prior to the AHEAD agreement. That is the State Health Department's improvement plan to address what we already know are issues across the board in Maryland. Queen Anne's, each jurisdiction was asked to select at least 1 measure. We chose 2 measures, and I'll explain why in a little bit. But the 2 measures we decided to tackle for the next couple years are, by 2029, increase the proportion of adults 18 to 85 years of age who have a diagnosis of hypertension and whose blood pressure was adequately controlled. The reason is because the reason we want to increase in that is because a lot of people are walking around, they don't realize they have hypertension. They call it the silent killer. So we're trying to educate, get people to understand, oh, you do have an issue and you need to address it, and educate them on ways to manage their hypertension or eliminate it entirely. The second one, by 2029, reduce the average wait time for primary care first appointments. Primary care access is one of our worst health metrics in Queen Anne's County. A lot of people have to travel to do a primary care appointment in Queen Anne's, believe it or not. They have to go to a neighboring county to get that care. In general, the primary care provider per person in the county is much higher than the state in general. So that is one reason we're deciding to tackle that one, and we have a program to address that, which I will talk about on this slide.
So Bryce, real quick, can I ask a question? So I guess with us being a bedroom community though, is that metric, are we getting a true reading on that metric? Because like a lot of people, I know like from dental, things like that, vision, a lot of people work across the bridge, so they've already established their primary care across the bridge, or their vision, or their dental. So we don't necessarily, in my mind, it would be very hard to gauge how many people here are using it in Queen Anne's County, right?
You're right. The metric that I'm referring to is the actual physical local providers per county resident.
When you use them, not who's using them.
Correct.
I got you, okay, okay.
The concern is that what about the people that can't?
Right.
So, we already know we have transportation concerns, access to care in general, and rural health is a major concern,
Gotcha.
especially on the eastern
So
shore.
it's looking at our local primary cares and their wait times specifically, not what people are experiencing.
Correct. So for chronic disease, the Wellness Division in the Health Department conducts community-based wellness clinics for hypertension screening and monitoring at locations like the senior centers and employment sites, and connects individuals to providers and resources. Dania's actually personally been on several of those visits. They're outstanding. It allows participants to track their health status. We give them resources. It's a fantastic program. And our brand new program, effective January 2026, we started our interim care program, and that is aimed at treating chronic conditions for people waiting to access primary care. So if somebody comes out of the hospital, for example, they're not connected with a primary care, they don't have a routine person that they go to, what we're gonna do is if they have high cholesterol, mismanaged blood pressure, and high blood sugar, basically, we're going to again screen them, we're going to do labs, we're going to have a nurse practitioner that will talk them through their conditions, how to appropriately manage them, and then we'll have a direct care associate that will work with that person to get them an appointment at a primary care office somewhere, hopefully locally. So again, the goal is to help them manage their conditions so they don't end up back in the hospital or someplace worse, as well as connect them to a primary care office to get them the services, a routine primary care provider to maintain them. So we started that January 1st, so we've started advertising it. We advertised it to the hospitals, the transitional care coordinator with Shore Regional, so hopefully we'll start seeing some patients in the near future.
I know who your first patient's gonna be, or your first test pilot. Let's put it this way, when I go to the doctor's, I can't have coffee before I go in for my appointment.
Got it. Rural health transformation. So OBA established the Rural Health Transformation Program. I talked about it briefly in the fall. But bottom line is, it's 5 years of funding. For the first year, Maryland was awarded $168 million. And Maryland actually received double the average amount per rural resident compared to some other states. So that's good news.
Is that operational and capital? 168 million?
Is it operational and capital? Yes. I'll talk about that a little bit here. So the three initiatives in Maryland's plan for the rural health money that was approved by CMS: transform the rural health workforce, promote sustainable access and innovative care, and empower rural Marylanders to eat healthy. They split it up into two different subject areas within the three domains: immediate impact and transformational impact. And the reason why is because when they did listening sessions back in the fall, it was clear that a lot of people had a lot of really good ideas that they could get off the ground real quick. So those are those immediate impact projects that they've put in their plan, and the transformation funds are those that are like, what are we gonna do over the course of the next 5 years? What can we start up to start addressing some of these shortfalls across the state? Workforce, again, talking about partnerships with Department of Labor, the Eastern Shore Area Health Education Center, thank you. We call it the AHEC, if you've heard that term. Talking about pipeline programs, getting kids interested early in school and healthcare, and trying to support them into different healthcare positions, doing shadowing. We would shadow people at the health department, the hospital, any of the primary care that would want to participate, but the AHEC would support them through that process, as well as supporting students in the university system and trying to get them to work here and stay here long-term. That's the key. Access to care, again, the state health department and us as well, working with our partners to identify access to care opportunities, one being mobile health, such as mobile integrated health. We've talked about how we would expand our program here in Queen Anne's County. We've talked about hiring a community health worker with this fund. The intent with that, again, is to be a point of contact for our patients to help them navigate the complexities of not just the clinical side of their concerns, but also what's going on like the social determinants of health, education, their housing especially, food access, all the different things that are tied to health at some point. And then Eat for Health, again, talking about expanding like refrigeration storage, working with Department of Ag, trying to develop partnerships with small farms to aggregate food and connect them with large buyers, different systems like that to improve access to healthy, nutritious food is all part of the larger plan. For the health department, again, mobile health service expansion is a priority. Right now, the plan is for regional local health department to receive funds and run an RFA, RFP process to benefit the entire region. For our region, that health department is Caroline County Health Department, but all of us are talking, we've been talking with the schools, we've been talking with other entities, Department of Emergency Services, to talk about what are the needs, what can we apply this money towards, and get an application in. Nutrition education programs, we've already had meetings with the Extension Office as well as Aging to identify where the gaps are, what education and other nutrition programs have gaps that we can fill with this money. With SNAP Ed funding ending, there's concerns that all that education kind of went away, so there's talks about maybe we'll try and bring that back just with a different funding source through the rural health money. Increasing capacity to process and improve billing and maximize revenue generation. So there's going to be a vendor that's going to analyze the local health departments and try to determine ways that we can improve our revenue to try to alleviate the pressure off of primarily being funding from county and grants. So that's what's going on with that. The Rural Health Transformation Program Steering Committee, that committee's been established. Unfortunately, only one rural local health officer made it on that group, which was disappointing. However, we do have some representation here from the shore. Delegate Greist is on that work group. I'm going to be reaching out to him to talk with him and have some conversations about this money and what our ideas are. The other local health officers in the region are also on board with that as well. Indirect opportunities with the rural health money. So MDH, again, will run RFAs to fund projects focused on expanding services, and that's across the gamut. But one of the big ones is behavioral health service expansion. They recognize that that is a major shortfall in rural communities. So again, applying that money to expand mental and behavioral health services in rural communities, as well as, again, workforce expansion programs, which I already discussed. Looking forward, again, we're awaiting further information from MDH, the Health Services Cost Review Commission, and CMS on the AHEAD and Rural Health Transformation Funds and our approved work plans. We haven't gotten approval for these things yet. Hoping to hear soon. Two of the immediate things that the state's implementing are medically tailored meals for high-risk patients. That's nutritious basically meals as treatment for those that do have complex chronic issues that it's a proven program in other states. So Maryland is doing a trial period with medically tailored meals to see if it has the same cost-effective, overall good impact for these high acuity patients. And then Produce RX, that's a prevention measure. Again, tailoring food is medicine to prevent people from getting chronic disease. Again, the education, getting them the access to that nutritious food. And those RFAs are projected sometime later this fiscal year. I believe that's all I have. Yes, it is. So any questions about that? It's quite a bit, right?
Covered it all, that's for sure.
What's our cut of the 168?
We don't know.
And any of that go towards, you know what I'm gonna ask?
Yes, and that project has already been submitted.
Okay.
I talked to Deputy Secretary Lord, who unfortunately has moved on since then, but I talked with her in the
She
fall.
what?
She resigned.
Good. Thank the Lord.
She has resigned, and so Katie Dilly and I with Midshore Behavioral Health, we have approached BHA to reestablish new partnerships with new people to talk about the USDA funding Queen Anne's County got for the Carter Center project, as well as other opportunities to address both outpatient and inpatient possibilities for mental and behavioral health on the shore.
Okay. When did you submit the, whatever you submitted?
So the
was that?
concept was submitted back in, I want to say September or October. So they're aware of it, it's on the list.
So it was submitted to Deputy Lord and she's
It was
gone.
submitted to MDH and then they funneled it out from there. And
Okay.
because it was a behavioral health project, it went to BHA.
All right. So we got a response from the governor's office, and I'll send it to you.
Okay.
Send it to you. Let me switch gears. Mobile health crisis. How does that work? How do you know when the mobile crisis for the schools should be sent to the schools? What's the criteria?
So mobile crisis reports to Midshore Behavioral Health, who then informs us, the health officers, the health departments, that one, they've been deployed and who they're supporting.
I'm sorry, who notifies you?
Midshore Behavioral Health, they're the core service agency.
Not the principal, not the school, not the teacher, not,
No,
They would not be allowed to, Patrick.
really?
no. There is legislation in right now to allow us to develop and implement our own local fatality review, suicide fatality review team. I'm in support of it, but it would allow us to legally get that information up front and to, again, convene the group of professionals to, no, it does not currently exist. There's a state one, but there's
So
not a local one.
How would they know to do that? How would a teacher that's having trouble, with a kid, how do they know to contact Katie?
They don't contact Katie, they contact Mobile Crisis. That's that's the plan.
Okay.
Now, I will tell you right up front that we're meeting in a week and a half to review those plans. I'm also trying to get in on a meeting next week with BHA. It hasn't been scheduled yet, to discuss the current issues, the sudden trends in these youths.
Thank you.
And to address that issue, find out ways we can be better and more proactive to figure out what's going on and get these issues figured out.
So I want to be really careful because we're on television in case there's kids watching, but, Saturday was a really bad day for our county. We had a really difficult funeral, and the night before was even worse. And I was asked personally by more than one person, why was there not mobile, why didn't the mobile crisis folks show up at the school?
So,
And this has happened twice. in the last two
I'll have to go back and
difficult
confirm it.
times?
I'll have to go back and confirm it, but from what I've been told, there has been resources sent to the school. There actually should be resources there still.
There were not.
Okay.
This is what I'm being told by a teacher. So, could you speak with him, like, outside? He knows what I'm talking about.
Okay, sure.
I'd rather not discuss it
So I'll
here.
confirm that, but again, we're gonna be reviewing, that response, and is that the appropriate plan? Mobile crisis with the family, mobile crisis with the school, and also other mental health resources for the school after one of these incidents.
Especially, the classes. So,
So I will
there's
double check.
something missing here. And I don't know what it is, but let's figure it out.
Will do.
Thank you.
Thank you. Any other questions?
Nope. Thank you, Tracy. Thank you. And welcome.
Thank you.
All right, Commissioners, also tab 6, item 2, we have Mr. Raymond Aaron, President, Fire EMS Commission, and Mr. Buddy Thomas. Is he in the house tonight? Not in the house tonight? Vice President
Mike Clark will step
for
in.
the Fire EMS Commission swearing in. So Commissioner Wilson, I think you have the official documents there.
Yeah, go on, just give us a quick update and then I'll swear you in. Go ahead, you're still president. Just give us a quick update and then I'll swear you in on the way out the door.
Quick update.
Sit down. Good Lord.
Thank you. I try to do what I'm told most of the time. Welcome, everybody. Thank you for having me.
Thank you.
Really, we're working with you folks for budget. We're working on some of the peer support group that you just were referring to. We're working on retention and recruitment still to keep our folks, keep them. You can get them, but the trouble sometimes is keeping them. And then we're continually trying to stay up on training because it's always changing. And we've got a good group of folks that come to our meetings. It seems like a lot.
Are you guys,
Supposed to be once a month.
are you guys inviting like vendors in to do presentations to the FEC for new concepts or procedures?
We
or-
have. The electric vehicle has been one that is probably one of the
Yeah,
last.
that's a big one.
It is, and I know it's been a topic of discussions. Huh?
The radios.
Yeah, certainly the radios, as you folks will have DES in before too long with a request for replacement radios. It's like a cell phone, they only last X amount of years and they don't make parts for it. So, 10 years after you spend 15 million, you're gonna spend another 19 million to replace it. So that's a project that's gonna take about 7 years.
That's the iPhone model. It's like every 2 years, you bring a new phone out, but you make sure you get a different charger for it. So
That's it.
Everybody's
Right.
gonna buy that other
This
charger.
newest one, nothing works.
That's how the radios work. I
Nothing.
figured that out.
So,
That
but
one
and all the
knob you
vendors
never
are the
buy
same.
again.
It's not just one
And
vendor.
part of that is cell service too, on the other end.
Yeah, that's pretty good. But that's, that's certainly it. Commissioner Wilson and Commissioner McLaughlin come to our monthly meetings. We've got, seems like 1 or 2 every week of the subcommittees. It's a good group of dedicated people. Buddy, the vice chair, just got back from being out of state, so he thought he was gonna be able to make it, but he's not. So I apologize. He called.
We'll get on him
Said
later.
you're on your own. Yeah, he knew he would.
We know where he
He
is.
ain't gonna
Yeah,
live that
yeah.
We
one
know
down.
where he was, where he is.
We'll embarrass him at the FEC next, right?
It's hard embarrassing.
Yeah, I know.
He's pretty-
That's one guy I don't know that you're really gonna do that to, so.
So I will entertain any questions, but if not, they, I guess,
Yeah, I got
kept me going for another year, so here I am.
Well, we are grateful for your leadership.
I appreciate it. It's a good group of people. Billy is, Faust is certainly a good resource to still have as he moves up for election in June for the state president for Maryland State Firemen's Association. You guys work great working with him as an employee, and it's a good resource for Queen Anne's, huge for Queen Anne. There's a lot of people involved in that organization from Queen Anne's County. So we've got a lot going on here.
Yep.
Which is something we need to bring up too, is about possibly sponsoring Billy for his running,
Yeah,
um,
yeah.
part of his fundraiser.
Yes,
So-
anything we could do to help you get that would be good.
So, all right, now you get to stand up. Raise your right hand. Use your name where I use mine. I, Jack Wilson,
Hi, Raymond Aaron.
do solemnly promise and swear
do solemnly promise and swear
that I will do to the best of my ability
that I will do to the best of my ability,
fulfill the duties of the office to which I have been elected,
fulfill the duties of the office to which I've been elected,
and uphold the bylaws of the Queen Anne's County Fire and EMS Commission.
uphold the bylaws of the Queen Anne's County Fire and EMS Commission.
At the conclusion of my term of office,
At the conclusion of my term in office,
I will turn over to my successor
I will turn over to my successor
all records and properties
all records and properties
trusted to my care,
trusted to my care.
so help me God.
So help me God.
Congratulations.
Thank you. Appreciate it. Back on time, I hope. Thank you all again.
All right, buddy.
Appreciate it.
Have a good
Thank you
night.
for your
Down
service.
real quick, I know he wants to go. Thank you.
Thank you, sir.
Thank you.
Thank you. All right.
Next victim.
That's all of our presentations tonight, Commissioners. We can move into
two.
the action items. So first, we have Department of Public Works has 2 items. So if you want to turn to tab number 2. Tab 2, item 1, pages 1 through 4, is the mosquito control program for 2026. This is a budgetary agreement between the state of Maryland and the county for the 2026 mosquito control cost share grant. Program budget for this year is $172,000, and it stipulates the cost share between the state and the county. And of course, we have the user fees, which is a subscription service user fee program. Total budget of $172,000. So we recommend execution of that state grant agreement.
I move to execute the 2026 mosquito control agreement with the Maryland Department of Agriculture.
Second.
Have a motion and a second. Any questions, discussion? Seeing none, all in favor?
Aye.
Opposed? 4-0 and 1 absent.
I knew it.
All right, thank you, Commissioners. Item 2 is for informational. This is the announcement of the Midshore Household Hazardous Waste Drop-Off Day, April 11th, 2026. Very popular program, and it's being hosted here at our own Department of Public Works at 312 Safety Drive in Centerville. This is a biannual event provided by Maryland Environmental Service as part of the Midshore Regional Recycling Program. And the event is open to residents of Queen Anne's, Kent, Caroline, and Talbot counties for any household items. So gather up your paint and old fuel and anything else you want to get rid of, and we'll take it out there at DPW on April 11th. And we have a nice informational flyer in the book, and I know Beth's been putting that out on social as well. So we always have a good turnout for this event every year.
And it was pretty cool. It came out through the county website somehow yesterday, I guess it was. And it's a new function. I've never seen it before when something came out, but you actually click on it. It actually adds it to your calendar, what you having to do it. You just clicked a button, and it populated it right into my, you back? Yeah. It went right into my calendar.
Excellent.
iPhone?
Good job. Good
iPhone or no?
My iPhone, yeah.
I think it's the AI in the phone.
Is it really?
Yeah.
But it was awesome, because I was thinking, I wanted to write it down and all, and I didn't have to. I saw the thing, and nice. So kudos, Beth, I guess. Good job.
Take credit, Beth.
Yeah, just take a bow, it's all good. All right, moving on.
Okay, next we have action items, so if you want to flip over to tab number 3. Tab 3, item 1, pages 1 through 2, this is the Community Reinvestment and Repair Funds allocations for FY 2027. This Reinvestment and Repair Fund was established under the Maryland Cannabis Reform Act of 2023. It is an initiative designed to reinvest cannabis tax revenue into communities disproportionately impacted by cannabis prohibition. And the fund focuses on promoting social equities, economic development, and addressing key community needs. Our LMB serves as the administrators of this program, and they have their allocations set here. I have Mike Clark and Rachel Carmody here that have put this together. Unfortunately, our funding this year from the cannabis sales tax is less than last year, but we have $160,000, $160,173 programmed for 3 key areas: Minority Entrepreneur Training Accelerator Program, after-school programming, partnering for youth, and account balance for growth and programs that will be established later. So if you have any questions, Rachel and Mike are here to address anything that you may have.
Motion.
I move to approve the allocations listed for the fiscal 2027 Community Reinvestment and Repair Funds in the amount of $160,173 effective July 1st, 2026.
Second.
Any questions, discussion?
So, on 2, it says,
Hold on, Patrick, come on up. If he's gonna ask a
Rachel,
question.
come on up. Yep.
hello.
Thank you both for being here and
Thank you.
administering this program.
So since this is cannabis, the providing education for them not to use it?
So, that, I think that was part of one of the state pieces, but when we had, well, actually, when I say we, I mean Lacey, when she was here, she worked with creating an ordinance, and something that was written into the ordinance was, minority entrepreneur training, after-school programming, and then homelessness prevention efforts were also written into that ordinance. So we are following what was written in that,
So
We also, excuse me, I'm sorry, we also followed the lead of the state gave us parameters to work within when we.
But you can
set
tweak
that.
it, right?
Oh, yeah.
Yeah. So teaching them what it does to their brain and the difficulties of it would be a good thing to do so that they don't end up in a bad place
Right.
with psychosis, things like that. So can you work on that? Thank you. Thank you. Does any of this, the answer is no. Drug-free, I was thinking of the Drug-Free Coalition, and this can't go to that, right?
I mean, they can definitely work on that. They have been working on it, and they've been a big advocate for the marijuana education you've been talking
Yeah.
about. And we support that group a
Yeah.
lot. We participate on it. We're very happy with it.
Okay.
Yeah, and Drug Free Coalition just submitted a more grant for their program for next year, and we have used the opioid restitution fund for their programming as well. So this is kind of a separate fund, but as they mentioned, there's a specific criteria that the state had put forth to utilize these funds.
Any more? Okay, got a motion and a second. All in favor?
Aye.
Opposed? 401.
Thank you very much.
Thank you.
Thank you
Coming
both
in.
for being here.
Thank you.
Appreciate it. All right, Commissioners, item number 2 on pages 3 and 4, I suggest we table that. We had some other legal issues.
Yeah, I'm gonna make a motion that we table this item. Do we have a time that we want to table it to, or you're
just
just
for-
gonna bring it back on the agenda at a later date?
We'll bring it back on a later date once
Okay.
it has additional
All right,
legal
So move, I'll make
scrutiny.
that motion.
Motion's table.
Okay. All right, Commissioners, our last action item this evening is item number 3. This is Resolution 2603, Aviation Obstruction Regulations. And this resolution establishes a process for considering variance under Title V, Subtitle 7 of the Transportation Article of the Annotated Code of Maryland, Aviation Obstruction Regulations for structure locations and size in the vicinity of the Bay Bridge Airport.
Can you get a motion?
Move to adopt Resolution 2603.
Second.
Motion and a second. Anybody want to speak to it? We good? No discussion? All right,
Self-explanatory.
good enough. All in favor?
Aye.
Opposed? 4-0 and 1 absent.
All right, Commissioners, that is all of the action items for this evening, all the presentations, so I think that concludes everything. We have press and public comment. If there's
Got
anybody
anybody
that
or
has,
whatever? Beth, did you have anything? Nope. All right. So we'll close press and public comment,
All right.
and we'll shoot the round table. Patrick?
I had the pleasure of going over to the Senate today. I found out last night, I ran into a charter boat captain down in Romancoke when I was out knocking on doors. And he told me about, today was, there was a Senate bill that the watermen have put in for rockfish. And apparently, which I did not know this, what the charter boat captains want to do is they want to stop catch and release on female rockfish. And some of these rockfish get to be 50, 60 inches long, which I had no idea, but they're massive. So what's happening now in March and April is as they're getting ready to spawn up by the Conowingo Dam, and people are catching them and releasing them. And according to the folks that were educating me, if a mama is outside the water for more than 2 minutes, she starts to let go of her eggs, and there's no male to spawn with the eggs. So the eggs die, And that's one of the reasons that they feel that the population of the rockfish are being slowly whittled down, so to speak. Anyhow, that was the point of it, and I don't know if it's still going on, but I had to leave because they kept moving it back and back. But it was just a great time to support our watermen and our charter boat captains.
That was the letter that we all signed 2 weeks ago that was sent in.
Yep, and the place was packed, and, you know, they won't let you stand. There's no standing room only allowed, so only a few people can get in. And, Jack, do you want to talk about Billy Faust, since you brought it up, or you want me to?
No, go ahead.
We served with this chap, as you know, Billy Faust, and he's the vice president of the Firemen's Association for the whole state. And the guy goes to literally every county, every week. He's in a different county, and it's, you know, it's on his own dime. And we were wondering, Jack and I were wondering, as the FEC, is there something that we could do for him? He is going to become our president, and there's only been, in 200 years, there's only been 3 presidents of the Firemen's Association from Queen Anne's County. Once again, Queen Anne's County is helping the state out, and his name is Billy Faust. So I would like to make a motion that we support Billy Faust with $2,500.
Okay.
I don't know. He does all of this on his own dime. He doesn't get reimbursed, he doesn't get mileage, he doesn't get anything from.
Specific for his presidential
Specific for his presidential campaign. So that's my motion.
I'll second that.
Motion is second. Any questions about it? And I'm sure he's going to want to see as many of us down there in mid-June as he can for
Yeah,
his.
he gets sworn in June in Berlin.
What's the date?
I'll get it.
Okay.
Yeah, we didn't.
Make sure
we
that-
didn't- Yeah, they have it now, but I don't remember what it was, but I'll get it. Okay. I'll share it out with you guys. Okay, got
Yeah.
a motion and a second. All in favor?
Aye.
Aye. Opposed? All right, 401.
Is that all you have?
You good? Chris?
I'm good.
Bill?
I just want to reiterate again the,
Aren't they taking boat wrap off? Don't you have to say something about that? Or
what's that?
aren't they taking boat wrap off soon? Shouldn't you say
Yeah,
something
right,
about
right,
that?
exactly. So I just want to reiterate the importance of April 11th for that midshore household hazardous waste drop-off. I mean, if you've got old cans of paint, I mean, things in your shop that you're waiting to get rid of that no transfer station or dump is going to take, here's a perfect opportunity. So can they go to the Queen Anne's County website and get more information on this, or they have to go to the Maryland Environmental Services website?
Yeah, we'll have it on our website and
Okay.
county website.
All right.
And we've been, yeah.
I mean, again, this is a great opportunity to get rid of some stuff that you've been harboring in your garage for forever. Fluorescent tubes and lamps, mercury thermometers, oil-based paints, paint thinner, stains, chemicals for pools, dark rooms, acid cleaners and solvents, computers and peripherals. I mean, this is an opportunity to get rid of all the things in your garage or that you're keeping that you've wanted to get rid of forever. So that's all I have. Take advantage of that, folks, because this is something that we work collaboratively with the state to get done. And I know I'll be taking some stuff.
I'm already building my pile as we speak.
Oh, yeah.
I've already started.
Better than hiding.
As soon as
a
I got that
contractor
email
bag or
yesterday,
putting
I
your
was
trash
out in the
can when it's
garage going,
looking.
wonder what I can get rid of.
Yeah.
Little early spring cleaning. So.
That's
So take full advantage. Other than that, that's all I have.
Excellent. I got nothing, so I will entertain a motion.
So moved.
Second. We are adjourned.
God.